Let's talk about the vaccine rollout. Look, you've had to make changes because circumstances change. 40 vaccine centres to administer inoculations to over 70s. Tell us what the plan looks like now.
Yeah, well, that plan had always been our plan in terms of vaccination centres all across the country. Obviously, we've had to change a plan last week based on the AstraZeneca not being used for the plus 70 cohorts. So there's kind of two issues running in parallel. So there's two pieces of the plan. Firstly, for the plus 70 age cohort, the agreement we've reached with the IMO and GPs who've been phenomenal last week working with us to rearrange the plan now. So there will be for next week for the 70 from the 15th for the 70 plus cohort starting with the 85s. We'll have the vast majority of those vaccinations carried out in GP practices themselves. There's about 1,300 GPs nationally, and 900 of them will complete their cohorts, their people in their areas in their own practices. We will have 3 vaccination centres across the country where GPs will come together. They'll be GP-led practices, and they'll carry out some of the remaining people in the 70-plus cohorts, and then there'll be some budding up between GPs. So that's one vaccination centres. Then we are actually heading into a very exciting phase with vaccination centres now all across the country. We've done great work on these, getting many of them ready now today. Some will be ready over the next couple of weeks. About 40 centres, as you said. Some of the bigger ones, 8 or 10 of them, will probably have a staffing of about 2,500 in total of various skills and professions working in them, spread across the country, with very significant workforce mobilised to support. So it's a very exciting phase as we head into it. The only issue, as you know well, is supply.
Delivery.
Constraining us.
Delivery of those.
Vaccines,
I mean, you must have emitted a fairly loud groan when the news came through. The AstraZeneca one shouldn't be administered to over 70s. You had to basically rewrite your whole plan after that.
We did. To be frank, it was nobody in any operational roles wants shocks or changes to the plan because they all take a lot of mobilisation. But look, it's the right decision.
You
fully
think so?
Understand it. It's policy now. Government from HSE, we're kind of clear. Once the decision is made, it's made policy. We go implement. And the issue, really, the decision was based on all 3 vaccines have been approved by the EMA. But the recommendation from the National Immunisation Advisory Committee and CMO was that to give the highest protection to the 70-plus cohort for this stage to use the mRNA, which are the Pfizer and Moderna vaccines.
Okay.
But look, these things change over time. Evidence emerges. I had always said this phase of the programme will be bumpy. It has proven to be bumpy.
It has. Actually, you talk about new evidence emerging. Interesting reports coming from South Africa this morning that they have put the rollout of the Oxford AstraZeneca vaccine on hold after a study there showed disappointing results against the new COVID variant, the South African variant. Does that set alarm bells ringing a little bit in the HSE? Because obviously you're still going to use the AstraZeneca vaccine in other age groups.
Yeah, again, exciting because today we start with the vaccine programme using the AstraZeneca.
Yeah.
Excuse me, with a lot of our frontline healthcare workers, so National Ambulance staff today, during this week, Dublin Fire Brigade staff, frontline healthcare workers. So, we are, again, it's now a third vaccine that we have to use. The South African variant would have a very, very small presence in Ireland.
So far,
so far, yeah, it's very small so far. But again, I think it's always a feature of these vaccines and rollouts that evidence emerges over different points in time. This even happens with a flu vaccine, and the vaccine changes itself as well, or the manufacturers change. But for us, it's a very small presence at the moment, and our plan is to go exactly in line with the EMA and continue rollout starting today all across the country.
Okay, everyone listening this morning, Paul, the question they'll be asking if they could talk to you directly, and their question would be, when am I going to get the vaccine? Where are we looking at now in terms of timescales? Look, things have happened and they're nobody's fault. They're certainly nobody's fault in this country, but it has pushed the timescale back a bit. Where are we at in terms of timescales?
Yeah, well, I guess to summarise what we know so far. So we know the supply line that's being committed to us for the first quarter 1. We've 690,000 of the Pfizer vaccine, 110,000 Moderna, and to just short of 300,000, 285,000 of the AstraZeneca. Now, I'd say that's committed, but we obviously take this week by what we're getting. There is a potential of a further 150, 160 AstraZeneca vaccines based on the EU agreement. So with that supply line looking ahead, we're continuing with our plan, which is the frontline healthcare workers all to be vaccinated. The continued plan, which has progressed well really now for the dose 1s and 2s of the people in long-term care facilities and residents and staff, and then continuing with through the other sequencing. So realistically, when we look ahead, the bigger kind of volumes start to arrive from May, June and throughout summer, and if our 17 million committed through the EU process arrives, in significant numbers, we would be starting to see over 1 million a month from May onwards. But again, everything we all know about the programme so far has been, the uncertainty of it and the commitment.
Is September then for doing everybody? Is that not? And I know you can't be nailed down because of the point you made, but is that still a possibility that everyone will be done by September?
Well, I guess what we always say from a HSE's perspective is whatever volume of supply comes to us, we will vaccinate, and that's been what we've done with the volume so far. We have no big major buffer stocks. Everything we get on a weekly basis, and we will commit that. So if those kind of volumes come with us, of course we'll be covering that level of population. But it goes with a massive qualifier with the world pressure that's on delivery at the moment.